to have you all here. We are at 218 participants, which blows my mind and is a new record for a MyHR webinar. So thank you very much for being here today, and yeah, I look forward to making sure that we have a valuable session. So a word about wellbeing before we kick off. Lockdown is really rough, and if you're in Auckland, we're going to have been at level 4 for 5 weeks. On top of that, we will all have had some commitments cancelled, whether that's regular sport or holidays. And it's really normal to be feeling kind of up and down at the moment. I had a bit of a rough 4th week of lockdown, so I'm right there in the trenches with you. If you do need some support and your employer offers EAP services, make sure that you do reach out and have a chat with a professional who can help. There's also the government funded call line on 1737, which you can text or call any time of the day or night for free support. So if you need a hand, or if you're having a bit of a tough time, please do reach out. There's support out there. So housekeeping for the webinar. This recording will be available afterwards on Facebook as well as on the MyHR website. What this means is all questions will be recorded and available afterwards. So if you would like to ask a question, you're very, very welcome to do so. These sessions totally come alive when we have those chats. Make sure that you don't use any details that are identifying if you do want to ask a question. And of course, you also have the choice to ask them anonymously. So feel free to put your questions in as we go through the session. Otherwise, just ask them at the end when we've wrapped kind of the formal content, and I'll make sure that I go through them in a Q&A session towards the end of today. So the plan is to spend about 25 to 30 minutes on content and then kind of 25 to 30 minutes answering questions at the end. Just to frame things up, this is an employment-focused discussion. We won't be talking about the science of the vaccines because I ain't a scientist. That's not something I can speak to. So if you do have questions or comments about the vaccines themselves, this is not the forum for you. We're going to be talking about vaccines as a tool for employers and how that might pan out over the next little while. So just to frame that up as we get started. So what we will do is talk about the relevant legal principles that relate to vaccinations as a workplace tool. We'll ask the question, can you require employees to get vaccinated with COVID-19? And the second question is, if yes, you can require them to get vaccinated, but then they decline, what are your options from there? How does that work? So legal principles, can you require employees to get vaccinated? And then if you do require and they don't, what do you do from there? So the principles to balance, as always, employment relations is very much about balancing different obligations. There's a couple of things we need to be mindful of. So the first is that everyone in New Zealand has the right to refuse medical treatment under our Bill of Rights. That could be refusing to get vaccinated, that could be refusing to have surgery done if you don't want that. You could refuse certain prescriptions that your doctor recommends. No one has the obligation to compel someone to undergo medical treatment. So that's pillar 1. Balanced against that personal right to determine what happens to your body and what happens with your medical treatment. Employers and employees both have obligations under the Health and Safety at Work Act to make sure that they are managing risk to themselves and to everyone else when we are in a place of work. So that's the second obligation we're managing, is that health and safety one. The third pillar is that employers have the right to fairly and reasonably manage their workforce so that they can operate effectively and efficiently doing whatever work it is that they need to get done. So that first pillar, no one can force you to have medical treatment. The second is that we all have health and safety obligations to each other at our places of work. And the third is that employers can manage their workforce as they need to, as long as they're being fair and reasonable about it. The reason we want to cover those off is that the vaccination conversation is a bit of a gnarly one because it is such a new area of interest and a new area with massive, quite large questions about it. There isn't a lot of case law in this area. So when we talk about what it's going to be okay or not okay for employers to do, we're using those very well established principles to inform that discussion so that we can go ahead and kind of get things done without potentially falling afoul of what the rulings are going to be in the future. So that's why we talk about those principles. Now, question 1 is one that me and the MyHR team are getting asked a lot at the moment. Can you require your employees to get the COVID-19 vaccinations? There are 2 categories of organisations here. The first are employers or organisations covered by the COVID-19 Public Health Response Vaccinations Order, which I'll just be calling the Vaccinations Order. and employers who are not covered by that vaccinations order. So we'll talk about these employers who are covered first, and then we'll talk about everyone else, which is basically the rest of us, after we've covered that off. So if there is work that your organisation does which is covered by the vaccinations order, then yes, you can require that vaccinations must be, or must have been, employees must be vaccinated to do that work. This means you can ask them about their vaccination status, you can store this information, and you can manage their employment appropriately according to those parameters. So workplaces that are covered under this vaccinations order includes workers at the managed quarantine and isolation facilities for obvious reasons, certain workers at airports and seaports, again as those points on our border where people can enter the country, air crew members, and workers handling affected items. So that might include the housekeeping team for the MIQ facilities, for example. And that's it. So that's a pretty narrow range of workplaces. If you're not dealing with the quarantine facilities, if you're not on the border or managing movement in and out of New Zealanders, you're not covered by the vaccinations order. So you fall into the category of everyone else. What this means is there is a different process to follow in order to decide that certain work can only be done by vaccinated workers. And it's worth clarifying a point here because this is where those principles come into play. I've just had a request from Jackie to slow down a little bit. I'll do my best, Jackie. There's a bit to cover off today, but thank you for the feedback. So when we are talking about vaccinations, you cannot require that any person gets vaccinated. You can certainly decide in your organisation that certain work can only be done by someone who has been vaccinated. So there is a subtle difference. And the reason this matters is when we start talking about how you manage people who have chosen not to get vaccinated, we're not talking about punishing or managing them because they haven't chosen to get a vaccination, but that they have made a choice, which means they cannot do work that has been decided must be done by someone who's vaccinated. So when you are not covered by the vaccinations order and you want to be looking at whether you can require that work is only done, or certain types of work is only done by people who have been vaccinated, there are two broad considerations we need to understand and assess. And the first is how, if you imagine I think that's the x-axis, I gave up maths a long time ago, on the x-axis, how likely is it that they will be exposed to the virus? If they're working on the border, it's potentially quite likely at the moment. The pandemic is still raging, Australia's cases are increasing by the day, so that likelihood is quite high. And then on the Y graph, you want to be assessing what the consequences would be if that person got sick. So we're thinking about if they work in an aged care facility, if a worker in an aged care facility got sick and then it spread through the rest of the community, that could be devastating and potentially result in quite significant loss of life. So the two pieces that we're considering are how likely is it someone will catch or be exposed to the virus, and then what are the consequences if they were exposed, what happens there. And this language will be familiar to some of you because it's the framework that we use to assess any other risk in a health and safety environment. Whether you are a pool cleaning and maintenance company and you deal with chemicals and hazardous substances, whether you're on a construction site and you are dealing with equipment and lots of moving items on a work site, whether you're in an office and working in close proximity with lots of other people, the likelihood and consequences assessment framework is a really established one. So what that means is you will need to complete a risk assessment process of the different types of work in your business before you can say anyone who is customer facing must be vaccinated, for example, or anyone who prepares food for our community service environment must be vaccinated. This risk assessment process is critical, and we would recommend that you do use a professional service or engage someone to help you provide this approach. You cannot say everyone in our organisation must be vaccinated because we think it's a good idea. That's not going to fly. You can say, we have followed a risk assessment process and here's all the documentation, and we've assessed that the likelihood and or the consequences of this work being exposed to coronavirus are too high for us to leave out the vaccination as a tool to manage that. So once that risk assessment has been completed, the next step, of course, is to look at tools to manage that risk. And vaccinations are one tool in a toolkit of many different things to manage the risk of someone catching COVID-19 and passing it on. So the other tools in that toolbox, which will be very familiar to all of us by now, are things like PPE, so masks and hazmat suits if that's appropriate, regular hand washing and access to facilities to hand wash, physical distancing and keeping ourselves further apart, limiting the number of people in confined spaces where there's easy aerosol spread of the disease, making sure your workers stay home if they're sick so they don't pass their germs on. And then, of course, vaccines are now a new tool that we have to manage this risk. So where you have decided that there is risk of someone either catching and being exposed to the disease or the consequences are too great, you must go through all of the assessment processes and look at all of the tools that you have to manage the situation rather than just relying on vaccines. For example, what we do know is that vaccinations stop, I think it's the Pfizer and AstraZeneca vaccinations, stop the spread of coronavirus by about 40 to 60%. So you're half as likely to pass it on if you are vaccinated compared to being unvaccinated, but that doesn't mean that you won't pass it on. So vaccines are certainly a tool to manage the risk of coronavirus in your workplace, but they're not the only tool. You can only deploy them as part of a suite of safety measures that you're taking to manage that risk that you've identified. So that's a lot of process chat. You've decided that you want to assess whether work in your business or your organization can only be done by people who are vaccinated. You've concluded a risk assessment process to look at the work that's been done. You've assessed the tools that you have to manage that risk and decided that vaccinations must be one of those tools for health and safety reasons. How do you roll this out and what are the next steps? So this is where we step back onto slightly firmer and slightly more familiar ground. It's just like rolling out any policy that you would otherwise bring into your business. So there must be a policy, it must be in writing, it must be presented to your workforce and anyone else who's a stakeholder. So this might be union reps, or it might be your health and safety committee or health and safety reps, depending on the size of your business. Everyone then gets some time to consider the proposed policy and give you feedback. Once you've had the feedback, you need to consider it and make any changes to the policy that you decide are appropriate based on that feedback. And then you confirm and roll it out and take things from there. So the consultation process is again very familiar. It's what needs to be done when any new policy is introduced. So there's nothing kind of too weird or unusual about this process. So to answer our first question that I asked at the top of the session, can you require that certain work is only done by vaccinated employees? The answer is yes, you can, but that is only the position you can get to, having gone through a risk assessment approach to look at the work your organisation does, to assess the risks of that work in the context of coronavirus, to then look at all of the tools that you have to manage that risk, and then deciding that vaccinations are a tool that must be used, and then consulting and introducing a policy. So as with anything in employment relations, it's never that straightforward. Again, this webinar will be available online afterwards for you to go back through and re-listen to if you need to. I know that there's a lot that I'm putting out there at the moment, so if you need to recap it, those resources will be available. So question 2, you are a business that has gone through that entire process. You are mandating that certain work is only done by vaccinated employees, and you have a worker or workers who are not vaccinated and are not going to get vaccinated. How do you manage that and what are the next steps? So the questions to ask yourself to start off with are there particular reasons that they have decided not to get the vaccine? They don't have to share them with you, but it makes it a bit hard from their side to argue that they should be treated kind of with special treatment. If someone is not getting the vaccine for health reasons, for example, they have a chronic condition or they are immune compromised, maybe they've been through chemo recently or they've got a chronic illness, It is not safe for people who have these conditions to get the vaccine. It is probably not a choice for them. They have been medically advised not to get it yet. Alternatively, it might be for religious reasons. If someone's faith outlines that they are not to have vaccine, or their interpretation of it is that it excludes vaccines, that's a protected category under the Human Rights Act. And if anyone is unable to get vaccinated for those reasons, you as an employer have a steeper obligation to accommodate them than you might otherwise. So first step is to find out if they will share why they're not getting vaccinated. The second piece is if they, regardless of why they are or aren't getting vaccinated, are there other tools you can use to manage the COVID risk that would account for them not being vaccinated? So one example might be, if we're talking about an aged care facility, for example, and the organisation has decided that workers who are dealing with clients and patients in that aged care facility must be vaccinated because they are talking to and dealing with and physically close to their patients, and one of those workers can't get vaccinated or is choosing not to, is there anything else that can be done kind of reasonably or practicably so they can keep doing their job but manage the risk? For example, if their colleagues are wearing face masks and being vaccinated, can they wear a full hazmat suit and not be vaccinated? Is that going to be enough to manage the risk? These are obviously enormously fact-specific questions, and I won't be able to go through all the examples. But if someone is not vaccinated, do you have other tools you can use to manage that risk so that they can keep doing their job? If you can't accommodate their lack of vaccination with other tools, your next step is to ask, are there other roles in the business or the organisation we could redeploy them to? So you can't go to termination as a first step. You must look for other options for work for them in the business to give them a chance to keep their employment. So for our friend who is working in an aged care facility and normally has contact with patients, is there a vacancy in reception, which is away from the vulnerable population that he or she could do? Is there admin in the back office where they're exposed to their colleagues but not exposed to patients? Would that separation be enough? Again, super fact specific. It will be different for every job and for every workplace, but go through that process to make sure that you can't pop them out of the high risk situation and put them into a lower risk situation, which would allow for them to remain non-vaccinated. If you have gone through that whole process, you've decided vaccines are required, you've consulted on the policy, someone has declined, you understand why they aren't getting it, you can't manage the risk with other tools, and there aren't other roles to put them into, at that point, yes, you can then consider terminating their employment. So the process to follow in that context, again, we step back onto firm ground, is the same for any other termination. So have your correspondence with them documented in writing is the first step. Advise the employee of the potential consequences of not getting vaccinated, which could include redeployment or termination. Consider whether you have any other roles for them and explain why you don't have anywhere else you can deploy them. Propose terminating their employment to them. They get some time to go away and think about it. Once they've come back with their feedback, you must consider it and have a think about their suggestions if there are any, or their feedback, and then you can decide to terminate their employment if that's where you get to. The good news is we now have a case to back this up, so we're not flying entirely blind, which is great. So recently the Employment Relations Authority, which is like the first decision-making body in the employment relations kind of court pecking order, ruled that Customs was justified in dismissing an employee who refused to get vaccinated because they were covered by the vaccinations order that I mentioned at the top of this section. They had a policy in place that they'd consulted on, that was all legit. They had looked at redeployment options for her because she was working on the border. There weren't other tools they could use to manage the risk. And she was given paid time off to consider kind of what she wanted to do. She chose to keep not getting vaccinated. In this case, we don't know why she couldn't get vaccinated. She didn't share this information. And then the customs proposed termination and followed a process and ended her employment. So the courts are pretty clear that there are circumstances where you can fire employees who don't get vaccinated. There is quite a ladder to climb to get to the situation where you can manage that outcome, not unreasonably, given that there is a lot happening right now, and this is a very new area of law. But the short answer to can you require that work is done, can you fire employees who don't get vaccinated? Yes, if their work is covered by your company policy, you've tried to find other roles for them or tried to manage the situation other ways and haven't been able to. And again, that normal termination process applies. So that's a lot of content. We've talked about the principles that are at play here. We've talked about, can you require that certain work is only done by vaccinated employees? Yes, you can, if that's an appropriate response to the risk that they face. And can you fire employees who don't get vaccinated? The answer is yes, if they fall into that category and you've tried other options to manage the situation, but nothing's going to work. So what I will do is open up to questions. We have 289 participants on this webinar, so if you all ask a question, I won't be able to get through them all. I'll scan through them on a case-by-case basis and answer as we go. I'm sure some of them will cover similar topics. If you do have questions after this webinar, you're very, very welcome to send them to us. The email address will be help@myhr.works. So you're welcome to send your questions through there, and I'll take some time this afternoon and tomorrow morning to come back to you all. But in the meantime, if you do have any questions or there is anything you would like to ask, please pop them through. I will start with questions that have come through the webinar, and then I'll jump over to Facebook and see if there are comments there as well. So let's jump to questions. We have a question. Our clients have requested that no one unvaccinated enters their property. What can we do? Yeah, this is coming up a lot at the moment. So your three options at the moment are, one, you illegally ask your employees for their vaccine status and take the risk that they will bring a personal grievance against you, but you'll keep your client happy. Two, you push back to your client and say, I can't do this, it's a breach of my employment obligations, and risk pissing off the client. Three, you really, really quickly get a health and safety expert to come and do that risk assessment process with your business to see if your work justifies a mandated vaccine requirement. None of those are good options and will take some time. The short answer is your client is asking you to do something you can't do legally right now. So you're in a bit of a sticky situation, and I don't have a silver bullet. Joe, if you did want to get in touch afterwards and have a conversation about it, just drop me a line and we can discuss further. We have a question. So is it okay to even ask staff for their vaccination status? Our advice at the moment is that you do not ask staff for their vaccination status unless you are covered by that public health vaccinations order. The reason for this is around kind of privacy and employment obligation compliance. There isn't, how to explain? If we compare it to other vaccination statuses, I've never been asked by my employers if I've had my mumps and rubella and tetanus shots to suddenly ask for health information that maybe isn't justified by the work that your team does. It runs the risk of a breach of the Privacy Act. So if your work is covered by that vaccination order, you can ask and store that information. If your work or your business is not covered by that order, do not ask for and do not store information related to vaccines unless it is a part of a policy that you're putting in place, having gone through that risk assessment framework. We have another question. Can the risk assessment tool include the effect of the business itself rather than spread to client base? For example, the risk of an unvaccinated employee spreading the virus through the workforce. Yeah, it totally can. So one of the risks of having a person in your place of work with coronavirus is that they spread it to their colleagues. So one of the questions that your health and safety expert would be asking and helping you answer is, what tools do we have, including the vaccination, to manage that risk? Do we have people work remotely if they're sick? Do we spread our desks further out so people are less close and that kind of thing? So your health and safety risk assessment will include the risk to spreading it amongst the organisation as well as to a client base. So yeah, that's definitely a component. We've got a question, would the lockdown have any effect on the notice period regarding resignations? No, it wouldn't. So if your employee has a 4-week notice period and they resigned at the start of the lockdown, they are still employed by you, so that 4-week clock starts ticking as soon as they resign. We have a question, what are the acceptable levels of risk that would allow for mandatory vaccinations to be implemented? Who sets the levels, or are they subjective? That's the magic question. I'm sorry, I don't have a clear answer for you. It really depends on your work environment and the work that you do, and how a number of other factors. So it's not subjective in that you can't make it up or base it on your feelings. Like any health and safety process, there will be best practice questions and thresholds to set, and we can certainly look at the customs examples and work covered by that vaccination order to get a sense of what levels are going to be acceptable. As long as you are being fair and reasonable, which sometimes sounds like a piece of string, but it's not hard to get to with expert help, you'll be okay to determine those levels, but I can't give you a black and white answer, I'm sorry. Can you ask employees about their vaccination status, even if you haven't created a policy, just part of a normal health and safety process? At the moment, we're recommending that you don't do that. There are privacy pieces to be mindful of, as well as employees potentially raising claims later for discriminatory treatment if they think something is based on their vaccination status. So our advice at the moment, the less risky approach is not to ask. If you do want to ask, you can do that. I'm not your boss. You can do whatever you like to do, but be aware that that is the risky approach and does open you up to personal grievance claims. So as a business owner or manager, you'll be wanting to assess the value of understanding people's vaccination status, weighed up and traded against the risk of potential legal action from them down the line. For new staff, can we put a requirement in their IEA? I assume you mean about vaccination status. Again, we advise not doing this unless you have a policy in place. It is much, much easier to get new employees onto different terms and conditions than it is to change terms and conditions for your existing workforce, as anyone who's talked to me before will know. But at the moment, if you don't have a clear policy governing why this information is necessary, how it will be used, how it will be stored, and kind of the benefit to the organisation, it's going to be hard to demonstrate that you do require it without running afoul of those Privacy Act obligations. If hiring a contractor, can you require them to be vaccinated? Contractors are not subject to the same protections that employees are. It's a commercial relationship between you and the contractor rather than an employment relationship. It would be easier to require that a contractor is vaccinated before engaging with them. Having said that, again, this is such a new area of law that the safe approach would not be to require that they are vaccinated. The riskier approach would be to require that they are vaccinated, and you need to weigh up the pros and cons of either of those approaches. Can we include a reference to COVID-19 vaccination in our new employment agreement? Similar to that question before, the answer is we'd advise against it right now. Again, if you've been through that risk assessment process and you've identified that you need this information for health and safety reasons and you can clearly articulate what those are, then yes, you can include it. If you don't have any of that background work done or that framework in place, we'd recommend staying away from it for now, because it's an unsettled question of law, and there's those Privacy Act breaches that you risk incurring as well. If you have completed a safety assessment, can you mandate vaccinations? The short answer is yes, if your safety assessment has determined that vaccines are an appropriate tool to use to manage the risks that you've identified to your workplace, identified for your workplace or for your customers. So it won't be a default outcome. Vaccines are one thing in your toolbox of many different things that you can use to manage the risk of COVID-19 at work. Do we still require a policy around vaccinations if we do not fall under the vaccinations order, or if we cannot prove that certain jobs may require vaccinated employees? whether you fall under the vaccine order or you don't, in both cases, you should have a policy following a risk assessment to outline why certain work must be done by vaccinated workers. So whether you are under the order or not, have a policy in both circumstances. If you don't plan on requiring that any workers get vaccinated and you don't have a policy around this, you don't need a policy document. If there's nothing your business is doing about this issue, you don't need paperwork to say we're not doing anything. So you don't need a policy in those circumstances. I'm getting a few questions here around asking existing employees or new employees if they have been vaccinated. I've answered this question a couple of times at slightly different angles, so I'm going to skip questions like that. If you've got a particular question that examines a slightly different element, you're welcome to ask it, but anything that's too similar, I'll just keep moving through. Here we go. Keen to understand if we can still have a register of employees' vaccination status if they volunteer it. That's a tricky one because employees are volunteering to give you the information. I guess in those circumstances, I would potentially make a note of it because they have told you, but I certainly wouldn't start compiling a register because then you are tracking vaccination status. Do you see what I mean? So even if the information has come to you by people volunteering or by you asking, having a register of info suddenly becomes tracking vaccination status. So at the moment, if you don't have a policy around it and haven't gone through that process and risk assessment and consultation, the less risky approach is not to track those vaccinations. Can a vaccine only halving the transmission rate mean you can justify it as the best tool to manage the risk? The short answer is that's certainly something to consider, but there will be more questions that come into play. So again, not being a scientist or a health and safety person, I don't want to tread on any toes here. So staying in my lane, what I will say is that the vaccines are demonstrated to reduce health and safety risk across a number of different aspects. You're less likely to catch the virus, which is good. You're less likely to get really, really sick from the virus, which is good. And you're less likely to pass the virus on, which is good. So vaccines are a really powerful tool, but because they require employees to undergo medical treatment, which again, we can't require anyone to do, they shouldn't be and won't be allowed to be the only tool that you consider. So depending on the nature of your workplace and on the nature of the work that's done, you may need to be a bit judicious about how you decide to use vaccines. So the short answer is, halving the transmission rate is a really good outcome. It won't be the only thing you consider when you decide whether vaccines are, whether you can justify requiring them or not. Got a question from a risk and outcome perspective. Isn't the risk of catching COVID and potentially spreading it universal rather than worse in some areas than others? We locked the whole country down after one case. I'm just trying to understand where there is a low-high difference. When I was talking about the risk of catching the disease, I wasn't thinking geographically. I was thinking in the context of roles where people have contact from people coming overseas. We know there is a lot more COVID infections internationally than there are locally. I was thinking about people who have high contact with vulnerable populations, high contact with people kind of full stop. So in terms of a risk assessment, it's less about where they are in the country, because you're right, COVID could show up anywhere. You might want to consider Auckland to be a slightly higher risk, given we've had so many of the lockdowns. I think that's debatable. The risk of exposure is more about the work that is being done rather than the geographic location of that employee. Hey, any suggestions to health and safety experts to assist with coming up with a site-specific COVID risk assessment? Plenty, probably too many to go into in this call. If you would like to have a conversation about that health and safety aspect further, do drop us an email. We're at help@myhr.works and we can talk about it there. Currently, schools ask for vaccination status when enrolling. How can they ask this? Schools are governed by different rules than employers are. There is some really well-established principles that schools can ask for reasonably detailed health and medical information about students because of the vulnerability of the population, usually being children and underaged, as well as the complexity of needs that those teachers are trying to manage. So the short answer is there is law and history that allows them to do so. And in the context of this conversation, schools are not governed by the same rule that employers are when it comes to their pupils and their students. They're governed by different rules, which allows them to do that. In an early childhood centre setting, we wish to give parents confidence that their child or children are being protected. As face masks are not used, it makes children nervous. We use hand washing, we clean the facility and so on. We would like to require that only vaccinated staff are able to have contact with the young children. That's a totally reasonable expectation. The next steps are to go through that risk assessment process to understand if the vaccine is an appropriate tool to use to manage that risk, then to write a policy and go through the consultation process. So those are your next steps. Do you consider an essential service operating at level 4 is more likely to meet the threshold for mandating vaccination, given workers might still be going to work while COVID is circulating in the community? That's an excellent question. I think that being an essential service could be one element of the risk assessment process that we assess. That would fall into the likelihood of being exposed to the virus, because as you say, they're out in the community if there are lockdowns, it's an indication that COVID is unmanaged at the moment. So I think being considered an essential service would heighten, for some workers who are required to go out into the community, does heighten the risk of them catching the disease, which would inform that risk assessment process. Ange is full of compliments today. Thank you, Ange, just providing some nice feedback about the session. We've got a question, who is doing the risk assessment? You could totally DIY this, just like you could DIY an employment agreement or a restructure or a disciplinary process or your taxes if you're that way inclined. We strongly recommend getting a health and safety professional to do these assessments for you. We are putting together a vaccination policy offering over the next week. So if you would like to be included, or if you have questions about what that might look like and you're a MyHR client, drop us an email at help@myhr.works, or if you're a large enough business to have a health and safety person in your business doing this kind of work, this is something that they will be all over. So get in touch with us or get in touch with your health and safety group. Very next question, can we do a risk assessment without an independent external organisation? Yeah, you totally can do one internally. You will just, if it comes under scrutiny, again, you will need to show that you are being objective and thoughtful and that you've gone through a fair and reasonable process. Just like doing your accounts, you get an accountant because they have the professional knowledge there. Just like when you're getting some plumbing done, you get a plumber in because they're the experts. The benefit of bringing in some support to get this done is that you are going to be getting you can be confident in your level of service and the quality of work that's being done, which is not to knock doing things DIY. Sometimes it's the best way, but especially when this is such a new and risky and highly kind of alive in the media topic, getting professional support just means that you're managing that situation as well as you can. Question, for a business who has breached the Act, what would the implication be? So depending on what the acts are, there are different escalation points for people to complain. So if you have breached the Employment Relations Act and an employee has a grievance or has been treated unfairly, their response is to bring a personal grievance claim. If it's under the Privacy Act, so let's say their vaccination information is being collected kind of without a policy or without being clear how it's going to be managed, they would lay a complaint to the Privacy Commissioner. If there's a human rights or Bill of Rights breach, it then goes to the Human Rights Tribunal and they kind of manage it from there. So depending on what act it is that you've fallen afoul of, there are different escalation points depending on the issue. Question, if a vaccinated person can still spread COVID, how do you reply to an argument to mandate vaccinations? That's a really good question. So the vaccines do a number of things to protect against COVID-19, and I listed them off before, but they are make it less likely you will catch it in the first place. If you do catch it, you get less sick, so you don't have the severe symptoms and are much less likely to be hospitalized. And they also reduce your spread of transmission. So across those three factors, vaccines are there's quite a powerful argument to mandate vaccines in certain contexts, and they are a tool to get a better outcome, right? So just because steel cap boots can't prevent all injuries doesn't mean we should stop using steel cap boots. We just need to use a variety of tools to manage the risk as best we can. It's the same with vaccines. They're not a silver bullet, but they certainly have really excellent outcomes. It's going to be hard to achieve without them. So the fact that it's only halving the transmission rate, it's halving the transmission rate. That should be an exclamation point sentence rather than a downer one. So I don't think that's going to be a convincing argument to not have vaccines, because halving transmission among the other benefits is pretty significant. What do you do if an employee will not come into the office because they believe other employees are not vaccinated? That's a really difficult conversation to have. I'll speak to it briefly, but then do drop me a message and we can talk about this further. If you as the employer have taken all health and safety steps to provide a healthy and safe workplace, your employees can't just choose not to come to work. That's not fair and reasonable. Examples that we're seeing some of are where employees are immune compromised. I've had a family member who's recently undergone chemo, and so for them, it's just not safe for them to go to work unless we're at level 1 or below. So there's that conversation. Sometimes people do just take the piss, and I don't like saying this because certainly it's the minority of cases, but getting paid the wage subsidy and being at home if you don't have to work is quite an attractive proposition for some people. So sometimes there is that element to it. The short answer is you can manage the situation, and ultimately you can fire them if they keep refusing to come to work. But there's a lot that can happen in that process. So if you do have someone who's refusing to come to work on the grounds of vaccination status, do drop us a message, we can help. My understanding is if an infected staff member came to the workplace would be shut down for a period. So is this enough to determine high risk to the business as part of that risk assessment process? It's definitely something that you would consider, particularly when you're in a food production or a healthcare or a kind of a high people contact environment. It's one of the things to consider, and you can decide that the vaccine, again, as part of that suite of tools that you have, is an appropriate tool to manage that risk. But the fact that your workplace would need to be shut down and quarantined for a period of time is not enough on its own to demand that the work done in your workplace must only be done by someone who's been vaccinated. Sorry, I'm getting a few of the same questions, so I'm just skipping ahead. Can we require staff to get tested regularly if they are reluctant to get vaccinated? That is an excellent question. We're doing a session on this in the next couple of weeks, so you're a bit ahead of me there. The short answer is yeah, you probably can. There are going to be rapid test equipment coming to New Zealand shortly. They're already in place in the States and the UK, I believe. I don't think Australia has them yet. So there is a scenario in the near future where employers will be able to quickly test their employees, just like a drug and alcohol test, to manage that risk to the workplace. Just like drug and alcohol testing, it is invasive, and so it has to follow that risk assessment kind of policy rollout procedure. But there is a world where you manage the risk of unvaccinated employees by testing regularly. That's a possibility. Cool. Question: if you redeploy someone who, I presume this question, if you redeploy someone, can you adjust the salary for the new role? I presume this means that someone has declined to get vaccinated as part of your kind of mandated requirements, and you're now looking at other roles to offer them. Yeah, you totally can. If you had someone who was on, say, $70,000 as an aged care worker, and then they didn't want to get vaccinated, but that was a mandate, and so then you are redeploy them into a receptionist role, which is a $55,000 salary, that you don't have to bring that new role up to their existing salary. You can say, well, you can't do this job anymore. Here are the other jobs we can offer you, and here are the pay rates for those jobs. And that person then opts in. So you're not obliged to top up pay to that person's previous salary. They need to make a choice about if they do want to accept any of the redeployment options, bearing in mind what the pay rates for those roles are going to be. We've got a question, what about the Bill of Rights where an individual has the right to refuse medical treatment in terms of mandating COVID testing? So testing is not medical treatment. Testing is about assessing someone's health, whether that be a pre-employment drug screening, whether it be hearing tests, whether it's like a drug and alcohol test is the best analogy. So requiring that someone submits to testing is not the same as requiring that they get medical treatment. So they're not comparable. You could pretty easily require that your workers do get COVID tested regularly if that was an effective tool to manage risk in your workplace. The difficulty is at the moment, all COVID testing goes through the public system, and as an employer, obviously you can't control that. I'm pretty sure that the government also doesn't want to be funding COVID tests for workplaces when they have a much more pressing public health need that they're managing. So that is probably going to be dependent on those rapid tests coming into play in the near future. What's the legal basis for the how likely is exposure question? Doesn't the Health and Safety at Work Act require all practicable steps for any non-negligible risk? You're totally right. The issue there, Kevin, is around assessing what that risk is going to be and assessing what the consequences are. So there's a likeliness column and then a likeliness axis and then a consequences axis. So it is likely that vaccines can be mandated where the chance of a worker getting COVID could be small, but the consequences could be massive. So it's not about just considering the likelihood axis, it's also about the consequences axis when determining what that risk is going to be. Cool. Scrolling through a few. Lydia has asked, do you have a recommendation of someone who undertakes these risk assessments for COVID? We're going to be doing them in the next couple of weeks. So if you would like to have a conversation with us about this COVID risk assessment process, drop us an email at help@myhr.works. Just put attention Sylvie or COVID-19 in the header and that will come through to me. We're going to be rolling out a service for MyHR clients exclusively where we do support you to do this risk assessment piece for vaccine mandations, for mandating vaccines. So yeah, do get in touch if you're interested in that. Heaps and heaps of questions coming through around, can you ask employees about being vaccinated? For anyone who had to take a phone call or who tuned out 15 minutes ago, at the moment we do not recommend that you advise them, that you ask employees of their vaccination status. If you don't have a policy justifying the collection of that information, and if you don't have a risk assessment demonstrating that vaccines are a tool you have determined is appropriate to manage risk in your workplace, you run the risk of employment and privacy breach claims, so we don't recommend that. Anonymous asks, thanks for that, great detail. You're welcome, Anonymous, no problem. Read the question, are there any other tools that could be used to manage the risk when reviewing refusal of vaccine? Wouldn't it always be yes, PPE can be used? The answer to that question is yes, PPE almost always can be used. But if we look at the case with the customs, which went through the Employment Relations Authority recently, they were using PPE. They had implemented distancing kind of requirements. So they were using all of the other tools in the toolbox and had still decided after a risk analysis question that the vaccine was a tool that reasonably helped manage the risk in their workplace. So I don't think we need to say you can never layer a vaccine on top of PPE. I don't think that's accurate. And in some situations, PPE won't be sufficient given either the nature of the work or where you are working really, really closely with people for extended periods of time. Think kind of nurses or surgeons or again, aged care workers. So I think the answer is yes, PPE will almost always be able to be used, but PPE in and of itself, especially given the infectiousness of the Delta variant, may not be enough to fairly manage the risk of COVID, and you in those situations would be able to require that vaccines are a layer of protection on top. We have a question from Tony. Is the unvaccinated person liable for loss of revenue due to spreading COVID through the business? No, in those circumstances, an employee would not be liable for losses spreading through the business. Brett asks, we sometimes need to send employees or contractors overseas for work. If vaccination is required by overseas governments, can we require anyone who needs to travel to perform their role to provide evidence of vaccination? The short answer is probably. Again, you would need to have that policy after having gone through a consultation process in place. And you would also need to be able to store and manage that information privately and securely. I would also be thinking about if you do have any employees who travel who won't be able to get vaccinated for good reason. Again, that might include because they're immune compromised or they have other health conditions where they can't get vaccinated. In those circumstances, you would need to think about kind of accommodating for them and managing their duties or change the duties given they can't have those vaccinations. Question from Lindsay, if our staff work on school sites, would they be governed by the school's vaccination rules or by our companies? Your employees are employed by your business, so they are governed by your rules. Your rules can take account of the rules of your clients, which might be schools or could be construction sites, or if you're a labour hire company and so on. But you would still, on a job by job basis, need to justify that vaccines or PPE or whatever the system is you put in place to manage that risk, you would still need to demonstrate that that was justified. And saying our client wants us to do this on its own would not be enough to justify mandating vaccines. So it's something you can consider. It can't be the only basis for requiring those vaccinations. Okay, we have blitzed through all the questions on the webinar. I will just very quickly scooch over to Facebook and see if any of those questions are coming through. So bear with me as I check, and if there aren't any, then we can certainly wrap up. Paul asks, will there be a certificate provided? If you're asking about the webinar, we don't provide certificates for attending webinars. If you would like me to send you an email confirming you attended, you're welcome to get in touch for that. And if you are asking about the vaccination process, it is recorded in your national health information that you have had the vaccine. Some people get little tickets depending on what their stage in the process is. And if you're asking about that risk assessment piece, then there will be documentation at the end of that to document that process. Andrea asks, how long can someone take off waiting for a COVID test result? And what if they say they don't have a result 5 days later and are still off? There are short-term absence payments available to pass to employees who are getting a COVID test and are required to self-isolate. If an employee can't work from home, you have the option to propose that they only receive either the wage subsidy or the short-term absence payment during that time. You may not have to pay them the whole time. And if they say they haven't had a test result 5 days later, to my understanding, that's quite long. That's quite a long wait at the moment. Test results are coming through in kind of 2 to 3 days. So there might be a conversation around next steps and then how long they're off on that unpaid leave for. Awesome. Okay, that was a lot. I'm sure you're all feeling as hit over the head as I am. Thanks again so much for being here today. It's always a pleasure to talk through these issues. A real thank you to everyone who submitted questions. If I didn't get to your question, my apologies. Please send through an email. Again, this webinar recording will be live on the MyHR site as well as on Facebook later on, so you can watch it and play it back. MyHR, again, will be rolling out a vaccination product in the next couple of weeks for MyHR clients, so do get in touch if you're you're interested. Otherwise, have a wonderful, wonderful, safe Tuesday afternoon. Please take care of yourselves and someone else if you can. And we'll look forward to seeing you at the next webinar. Ka kite.